Have you ever woken up in the middle of the night with a strange feeling that something just isn't right? Maybe a headache that feels different than usual, or a bout of dizziness that comes out of nowhere. What if I told you that these seemingly minor nighttime disturbances could be your body's desperate attempt to warn you about something far more serious? Hello there. I want to have a very important conversation with you about something that could quite literally save your life or the life of someone you love. We're talking about the hidden warning signs of stroke that show up in the dark of night, often when you're most vulnerable and least expecting it.
Now, I know this might sound frightening, and believe me, I wish I didn't have to be the bearer of such serious news. But the reality is that every 40 seconds, someone in America suffers a stroke. And what's truly heartbreaking is that many of these strokes could have been prevented if only people knew what to look for in the critical 30-day window before they happen.
You see, your body is incredibly intelligent. It doesn't just suddenly break down without warning. There are always signals, sometimes subtle, sometimes dramatic, that something is wrong. And when it comes to strokes, these warning signs often intensify during the nighttime hours when your blood pressure naturally fluctuates and your brain is processing the day's events. The most alarming nighttime symptom, the one that research shows is strongly linked to an impending stroke within just 30 days, is what neurologists call nocturnal hypertension spikes. In plain English, that's sudden, dramatic increases in your blood pressure while you're sleeping. The trouble is, unless you're hooked up to monitors in a sleep lab, you can't directly measure these spikes. However, your body will let you know they're happening through other symptoms that you can notice.
Let me ask you something personal. Have you ever woken up suddenly, heart racing, with a pounding headache at the base of your skull? Or perhaps experienced unusual dizziness or vertigo when getting up in the middle of the night? These aren't just random discomforts or signs of aging. They could be your body's desperate attempt to tell you that your brain is in danger. I recall Mrs. Johnson, a vibrant 67-year-old who visited my office complaining about what she referred to as weird headaches that would wake her up around 3 a.m. She'd been having them for about 3 weeks, but dismissed them as stress or maybe her new pillow. When her blood pressure readings came back, I immediately scheduled her for further testing. Those weird headaches were actually warning signals of dangerously high nighttime blood pressure spikes, putting her at imminent risk of a major stroke. The intervention we started likely saved her from devastating brain damage or worse.
Now, you may wonder why these symptoms appear at night in particular. It's a fascinating aspect of our biology. During healthy sleep, your blood pressure is supposed to decrease by about 10 to 20%, a phenomenon known as the nocturnal dip. But for many people over 60, this natural rhythm becomes disrupted. Instead of dipping, blood pressure actually rises during certain sleep phases, putting tremendous stress on the delicate blood vessels in your brain. This disruption doesn't happen overnight. It builds gradually, often showing itself through subtle signs weeks before a stroke might occur. And here's what's truly worrying. Conventional doctor's visits might completely miss these warning signs because they're measuring your blood pressure during the day, when you're awake and often more regulated. What makes this particularly concerning for those of us over 60 is that our blood vessels have already undergone decades of wear and tear. They are less elastic and more vulnerable to pressure changes. So when these nighttime spikes occur, the risk of a blood vessel rupturing or becoming blocked increases dramatically. But I don't share this information to scare you. Well, perhaps a little fear is warranted when we're talking about something as serious as stroke prevention. I share it because knowledge truly is power, especially when it comes to your health. Recognizing these warning signs could mean the difference between catching a problem early when it's still manageable and facing a life-altering medical emergency. In the next part of our discussion, we'll dive deeper into the specific nighttime symptoms you need to watch for, the ones that most often precede a stroke, and exactly what you should do if you experience them. Because timing is crucial. When it comes to brain health, I want to ensure you're equipped with the necessary information to protect yourself and your loved ones. So what exactly should you be looking for? What are these critical nighttime warning signs that could save your life? Let me walk you through them, because recognizing them early could mean the difference between complete recovery and permanent disability. The first and most telling sign is what I call the 3 a.m. wake-up call. This isn't just ordinary insomnia. It's a sudden awakening, often between 2 and 4 in the morning, accompanied by a feeling of unease or distress that you can't quite put your finger on. Your heart might be racing, or you might feel an unusual pressure in your chest or head. This specific pattern of nighttime awakening has been linked to those dangerous blood pressure spikes I mentioned earlier. Many of my patients describe it as feeling wrong, not necessarily painful, but deeply unsettling. And here's what makes it particularly dangerous. Because it happens during sleep, many people simply roll over and try to go back to bed, dismissing it as just another sign of aging or stress. But your body is desperately trying to tell you something. I'll never forget Tom, a retired teacher who came to see me after experiencing what he called weird dreams for several weeks. He would wake up feeling like he couldn't catch his breath, with a strange tingling in his left arm. He'd shake it off and go back to sleep, thinking it was just anxiety about his upcoming upcoming surgery. When I ordered an urgent carotid ultrasound, we found a 90% blockage in his carotid artery, a ticking time bomb that could have resulted in a massive stroke at any moment. Those weren't weird dreams, I told him. That was your body sending you emergency alerts. The second critical nighttime symptom is sudden sleep disturbances paired with balance problems. Have you noticed that when you get up to use the bathroom at night, you feel unusually unsteady or need to hold on to furniture to maintain your balance? This isn't just normal sleepiness or a natural part of aging. When these balance issues come on suddenly or worsen over a short period, especially when accompanied by other symptoms like headache or vision changes, they could indicate reduced blood flow to the cerebellum, the part of your brain responsible for coordination and balance. One thing that makes this particularly deceptive is that the balance problems may seem to improve during the day, leading you to dismiss them. However, the nighttime occurrence is significant because that is when your brain is most vulnerable to changes in blood flow and oxygen levels. If you're still here and this video is helping you, please leave a quick comment below. I'd really appreciate knowing you're watching. And if you haven't subscribed yet, now's a great time. Tap the bell so you don't miss the next one. Let's keep going. The third warning sign, and this one is particularly important, is nighttime facial numbness or asymmetry that resolves by morning. Perhaps you've woken up with a strange tingling or drooping on one side of your face, only to have it disappear after you've been up and about for an hour or so. Many people attribute this to sleeping funny or pressure from their pillow, but transient facial weakness, especially when it consistently affects the same side, is a classic warning sign of a mini-stroke or TIA, transient ischemic attack. These mini-strokes often happen during the night when blood pressure fluctuates, and they can resolve so quickly that by the time you see your doctor, there's nothing for them to find. But they are powerful predictors of a full-blown stroke. Up to 40% of people who experience a TIA will go on to have a major stroke within 30 days if the underlying cause isn't addressed. Martha, a 72-year-old grandmother of 5, mentioned to me almost as an afterthought during her annual checkup that she'd been experiencing weird morning numbness in her face for about 2 weeks. "It's gone by the time I finish my coffee," she said, clearly not worried. That casual comment led to tests that revealed dangerously high nighttime blood pressure and significant narrowing in her carotid arteries. The treatment we started likely spared her from a devastating stroke that her neurologist believed was imminent. I want to be absolutely clear about something. If you experience any of these symptoms, the 3 a.m. wake-up calls accompanied by a feeling of distress, sudden nighttime balance problems, or transient facial numbness that resolves by morning, you should treat this as a serious medical warning. Don't wait, don't dismiss it, and most importantly, don't let anyone else dismiss it either. You see, one of the most dangerous phrases I hear from my older patients is, "Well, at my age, I should expect some problems." This mindset can be deadly. Yes, our bodies change as we age, but sudden neurological symptoms are never normal at any age. They are your body's alarm system, and ignoring them is like disconnecting a smoke detector because the beeping is annoying. In my 30 years of practice, I've seen far too many cases where these warning signs were present for days or even weeks before a devastating stroke. In almost every case, the patient recognized that something unusual was happening, but did not realize the significance or urgency of their symptoms. So, what should you do if you experience any of these warning signs? First and foremost, don't wait. The standard advice to call your doctor in the morning could be dangerously inadequate when it comes to stroke prevention. If you experience sudden, severe symptoms like facial drooping, arm weakness, or speech difficulties, what doctors call the fast signs, you need emergency care immediately. But what about these subtler nighttime warnings we've been discussing? My recommendation is firm. Any new or unusual neurological symptom that wakes you at night deserves a same-day medical evaluation, not next week, not when it's convenient, today. When it comes to your brain, the stakes are simply too high to take chances. People often tell me they don't want to bother their doctor or waste emergency resources if it turns out to be nothing. Let me be crystal clear. Protecting your brain is never a waste of time. Even if it turns out to be a false alarm, the peace of mind alone is worth it. I've seen too many patients who waited, hoping the symptoms would go away, only to suffer preventable damage. Your brain doesn't have unlimited capacity to recover from injury. Every minute, a stroke progresses, and approximately 1.9 million brain cells die. That's why neurologists say time is brain. Those cells and the functions they control may never come back. Now, beyond seeking immediate medical attention, there are critical actions you can take tonight. Yes, tonight to potentially reduce your risk if you've been experiencing any warning signs. signs. First, check your blood pressure if you have a home monitor. If it's above 140/90, this needs urgent attention. Second, take note of when the symptoms occur and their exact nature. This information can be invaluable to your healthcare provider. And third, if possible, avoid sleeping alone. Have someone nearby who can help if symptoms worsen. What about prevention for those who have not yet experienced symptoms? The research here is compelling. Regular nighttime blood pressure monitoring, not just daytime readings, could be one of the most important things you do to protect yourself from stroke. Studies show that nighttime blood pressure actually predicts stroke risk more accurately than daytime readings. Yet most doctors never check it. One approach that's shown remarkable results is what I call the 10 p.m. checkpoint, a systematic evening routine designed to lower your stroke risk while you sleep. It includes taking any prescribed blood pressure medications at the optimal time, often in the evening rather than morning, spending 5 to 10 minutes in quiet meditation or deep breathing to lower blood pressure before bed naturally, and elevating the head of your bed by just 6 inches, which has been shown in studies to reduce nighttime pressure spikes by up to 15%. If you're still here and this video is helping you, please leave a quick comment below. I'd really appreciate knowing you're watching, and if you haven't subscribed yet, now's a great time. Tap the bell so you don't miss the next one. Let's keep going. I also want to address something critically important: the relationship between nighttime stroke symptoms and certain medications. Some commonly prescribed medications, including certain pain relievers, decongestants, and even some antidepressants, can significantly increase your risk of nighttime blood pressure spikes. If you are taking any medications and experiencing any of the warning signs we have discussed, you should schedule an urgent medication review with your healthcare provider. Let me share something personal. My own father ignored nighttime headaches and dizzy spells for weeks, dismissing them as just getting older. By the time he finally agreed to see a doctor, he suffered a stroke that left him unable to speak clearly for the rest of his life. I still remember him trying to tell me something important in the hospital, but the words wouldn't come. That moment changed everything for me as a doctor. It's why I'm so passionate about sharing this information.
The tragedy is that his stroke was likely preventable. The warning signs were there, those nighttime symptoms that seemed minor at the time, but were actually his body's desperate attempt to alert him to the danger. His experience taught me that when it comes to stroke prevention, we simply cannot afford to wait and see. I realize this is frightening information. Nobody wants to think about the possibility of a stroke, but knowledge truly is power, and understanding these warning signs could save your life or the life of someone you love. The good news is that when caught early, responding to these warning signs rather than dismissing them can prevent many strokes.
Remember Mrs. Johnson, whom I mentioned earlier? She recognized her nighttime symptoms for what they were: warning signs, not just inconveniences. She received prompt help, and today she's enjoying an active retirement, traveling and spending time with her grandchildren. Her story could be your story too. The human brain is remarkably resilient, but it needs your protection. It needs you to listen when it's telling you something is wrong. Those nighttime symptoms, the unusual wake-ups, the balance problems, the transient facial numbness, they're not just annoyances to be endured. They're potentially life-saving warnings that deserve immediate attention. So tonight, as you prepare for bed, take a moment to reflect on what we've discussed. Have you been experiencing any of these warning signs? Have you been dismissing symptoms that deserve attention? If so, please don't wait another day to seek help. Your future self and everyone who loves you will thank you for taking action now. And remember, stroke prevention isn't just about avoiding something bad. It's about preserving your ability to fully participate in all the good that life has to offer. Your memories, your independence, your ability to communicate with those you love. These precious capabilities are worth protecting. Thanks for watching today's video. Take a moment to comment below with one takeaway and how you'll apply it in your own life. We really do read and appreciate every message. If you found this content useful, like, subscribe, and share it with someone who might benefit. Your support helps us continue to show up for you. See you next time.